Nowadays we take general practice for granted, but over 70 years ago that wasn't the case. So many patients were frightened of becoming unwell because they knew they simply couldn't afford to see a GP. In those days before the NHS, you had to pay for a consultation each and every time you saw a GP. You had to pay for treatments, which we now take for granted. Also, general practitioners didn't have the same level of treatments and investigations that we have now. They were very limited in the medication and drugs that they could use. This is a typical shot from the early 1900s. You can see the range of bottles and pills and potions that a typical pharmacist would have available. They weren't supplied by large drug companies in those days. They would make their own medicines and provide them to their patients who would visit them. From the early 1900s, doctors would start to prescribe on a prescription and provide those prescriptions which a patient may take to the pharmacist, but also doctors would dispense their own medication as well, which they would carry with them or potentially make and bring together pills and potions that they would then give to their individual patients. And there was a degree of competition between the pharmacist and the general practitioner. And as the NHS started to develop, there was much more collaboration between the GP and the pharmacist, trying to ensure that all patients got access to the most up-to-date and best available medicines. At the turn of the 20th century, midwives were already playing an important role in ensuring that women had safe delivery of their baby. But GPs too would often deliver babies at home, and I remember my own senior partner when I joined my practice still talking about the days when he would regularly deliver babies at home and then would look after them throughout the rest of their life. But in the 1940s, when the NHS was founded, most GPs would work in small terraced houses, maybe their own house, and providing services to patients who were waiting for them in the front room. Nowadays, as we know, surgeries are quite different, providing a whole range of services through a whole range of different people working within those buildings, and in some cases providing digital services to patients who aren't actually in the building but are nevertheless getting good care from their GP and their practice team. Modern general practice like this one, we have a whole team of people working alongside a group of GPs, some GPs with special interests, but all of us with the patient at the heart of things, and we're able to provide them with support, but now in a far better way than we could back in the 1940s. So then GPs would keep very limited records, maybe 2 or 3 sides of paper within a patient's record. All of our record is dependent on our computers, but also our computers help to improve the quality of care that we're able to provide our patients. Our computers prompt us to the right medication to use, the interactions that medications might have, because increasingly now patients are living longer and living with more complex problems, and they need to see their GP and their practice team more often. We now live in a digital age. We know that patients, before they've seen their GP, are accessing information such as the NHS Choices site, and we use our information and the information that they have to try and find the best possible treatments for our patients. But we're also able now to offer patients support without them even stepping into the practice building. We regularly have telephone consultations and increasingly video consultations and other ways of contacting and connecting with patients. But ultimately, at the root of good general practice, it's that direct link between GP and patient, between practice nurse and patient, and increasingly other members of the practice team providing good quality general practice primary care.